Spring routinely spells misery for allergy sufferers. A recent study revealed most patients don't try to manage their symptoms until it's too late. Toro family medicine physician Dr. Meredith Maxwell is here to share ways to ease allergy discomfort and keep asthma symptoms in check. Hi, Dr. Maxwell.
Hi.
So first things first, a lot of people probably mistake the symptoms of allergies for maybe the common cold or even the flu, right?
All the time. I can't tell you how many patients come in and are like, I have had this cold for like 4 weeks. and the difference is there's a lot of itching and thinner secretions. So like the nasal secretions are not as thick.
Okay.
So it's easy to get confused. So if you have something like that, go see your doctor because it might be allergies instead of a virus that's lasting forever.
And the thing that's important to know is there's different types of allergies. There are seasonal allergies or nasal allergies, right?
And there's year-round allergies as well.
Allergies.
Yeah, so seasonal is more like what's blooming.
Okay.
So like ragweed and trees and things like that. And the perennial, like the year-round are like the mold that's popular in New Orleans because we live in a damp climate, the dust that's around. So there are people that can have just kind of seasonal, like, oh my goodness, it's spring,
right,
or year-round. They have kind of this, they're fighting it all the time.
And there are different ways to treat the different allergies.
There are. There's lots of over-the-counter options, the antihistaminics, like the Claritin, the Zyrtec, the Zyzols, all of those things. And then there's like the steroidal pathway, like the Flonase, all the nasal sprays that you have, and then there's some prescription things that you can use as well. So there's lots of options. You need to really talk to your doctor about what's best for you, and it's a building thing. And I found that if you start early and are consistent, your allergies are a lot more controlled than if you're chasing them all the time.
Because you don't ever want it to get to the point where you're having an allergic reaction.
Correct. And that can be hives, that can be, throat closure. That's a little bit more severe. So usually with perennial or seasonal allergies, you don't really see that, but it could happen.
How at risk are children with allergies? I mean, are children just born, some of them genetic-wise, with allergies, or are they more prone to it?
Right. Well, we think it's maybe a combination of both. But things with kids are really important because they usually happen in a triad of allergies, maybe skin rashes, and you can also have asthma on top of that. So if your kid has those other two, you might be looking out for breathing problems as well down the line. But they can develop it or be genetically kind of predisposed to it.
Gotcha.
Yeah.
Because asthma is a lot more dangerous than allergies. I mean, having asthma is really the breathing issues.
Right, exactly. So you have to kind of be on the lookout for that. A nighttime cough is a really kind of funny thing that you can present with asthma. So that's something that kids kind of present with that you might think in the back of your mind this could be asthma.
And it could be a recurring cough, not just once, every blue moon. This is something that happens frequently.
Exactly.
Okay. Well, I guess, and if you have these symptoms in your child, you want to make sure you take them to an allergist. That's probably the best first step, right?
I would start with your primary to make sure it's appropriate, but yes, and if they deem that they need specialized testing, like skin testing, figure out what they're exactly allergic to, then an allergist would definitely be appropriate.
All right. Good advice. Dr. Maxwell, thank you.
Definitely.
As always.